I want to raise awareness in this video for anyone that has had an abnormal smear and then had a following gynecological procedure after it. So in 2020, I had an abnormal smear and they came back grade 2 and grade 3 lesions, and therefore I had to have a LETS procedure to remove the bad cells. Because of that, this now means that my cervix is shorter than the average person, because what they do is they take away the abnormal cells from your cervix. I just found out some news yesterday which I'm trying to process. Now, I'm 18 weeks pregnant and I didn't realise that, well, I did realise, and that's why I went and had the scans, but obviously having a short cervix can cause you to go into preterm labour. My cervix is measuring under the threshold they would consider a normal length or a safe length for pregnancy. So I now have the diagnosis of a short cervix, and this is due to the gynecological procedure that I had in 2020. I'm now part of the clinic and I have to go every 2 weeks to basically have my cervix measured, and I've been given progesterone pessaries to essentially make sure that the cervix doesn't shorten anymore. This was not explained to me when I had the gynecological procedure done back in 2020. Obviously, I had to have it done because they were quite bad lesions, and I wouldn't not have had that done, but it would have been great to have been educated on the fact that, yes, they say that your risk of preterm labour may increase, but they don't talk about it in detail, and the fact that you do have a shortened cervix and therefore you will need to be extremely monitored throughout your pregnancy. So any pregnant mamas out there that have had sort of any gynecological procedure, please push your midwife for these extra scans because it could save you and your baby's life. I now have to take every week by week to make sure that we get through to the next stage, so it's quite overwhelming to process, and let's just pray that everything will all be fine.